Hi, I'm Zanzi. You are listening to Farmers Inside Track, proudly brought to you by Food from Zanzi. My name is Patricia Tembo, your host, and welcome to episode 549. Today we're looking at pneumonia in livestock. This episode is said to be both informative and practical as we welcome Kenneth Malatji, who is an animal health technician at AfriVet. He'll be unpacking how to manage this disease. Kenneth Malatji, welcome back to Farmers Inside Track. We're glad to have you on today's episode again.
Thank you so much, Patricia, for having me. And it's always a joy coming and sharing my experience with my wonderful farmers in South Africa.
And you are definitely a regular with Food from Zanzi. So I know our farmers, some of them listening may have already listened to previous podcasts where you shared your expertise. Kenneth, you're an animal health technician at AfriVet, and you also do have your master's in virology. But maybe for those who don't know you or who haven't heard about the work that you're doing, could you just give us an overview?
My name is Kenneth Malatji. I'm an animal health technician at AfriVet Training and Technical Services. So what we do trainings to the farmers. So we support our main business, which is AfriVet. So AfriVet produces medication that farmers use on a regular basis, which are Ultratet, Eraditic 125, all the medications that we'll be mentioning today that treat pneumonia, tick-borne diseases. So we support all those products by doing training with farmers, because if you can have product that is very effective, but if you do not use it effectively, it won't be effective. So we're trying to bridge that gap to train our farmers how to use our product and just to train them on how to manage their livestock in general.
Today's episode is just going to be very informative for our livestock farmers in how to manage or rather preventing pneumonia outbreaks in the herd. To set the scene, context for what we're going to speak about today, what are the main causes of pneumonia in a herd?
So pneumonia is a serious inflammation of lungs and airways that affect animals' ability to breathe and get enough oxygen. It can be developed from several causes. So there are many causes that cause pneumonia. So in simple terms, I can say pneumonia happens when the lungs of animals get infected or irritated. Most of the time, it's not just one thing. So it's germs plus stress, but I will explain that further as we go. So the main causes of pneumonia can be, number one, it can be germs. What do I refer to when I say germs? So germs can be bacteria and viruses. So often viruses start the process. So when an animal is infected by a virus, they attack the lungs and weakens the immune system of the animal, making it harder for the animal or the immune system to fight the infection. So mostly bacteria take advantage. They go there as a secondary infection. So they take advantage of the weakened lungs or the weakened immune system of the animal that can lead to pneumonia. So in short, what I try to explain that the virus can open the door, bacteria can cause severe disease. So the combination of this commonly known in cattle is often called bovine respiratory disease, BRD. Number two, main causes of pneumonia is stress and poor management. This is the biggest trigger. So stress is the main reason pneumonia spread in a herd. So common stress factors include weaning. So when a calf is about to be weaned, so if its daily activity was to get milk from its mother and get food. So now you have to take the mother away, you're stopping it from getting the milk. So that weaning process is stressful to that calf. That stress can trigger into pneumonia. Transportation and long distance travels. So when the animals are moving from one place to the other, when they are traveling, so the animal gets stressed, and that stress can, for some reason, cause the animal to have that pneumonia because of that stressful event and everything. Mixing of animals from different sources. So animals, they are just mixed up. Some are behaving funny, some are being rough, overcrowding, overventilation, the fluctuation of weather or dusty conditions, sudden change in weather, as I said, can cause pneumonia. So when animals are stressed, their body cannot fight infection properly. So that can cause them to have pneumonia. Number three, poor housing. So just proper shelter. So bad air damages the lungs. So When there's dusty feed, the kraal, the manure is very dusty. There's ammonia smell from the manure, just poor airflow that can also trigger pneumonia. The fourth one, which is mostly done when a farmer is trying to help the animal, is aspiration pneumonia. So it's breathing the wrong thing. Let's say a calf or maybe a kid is not getting enough milk. So a farmer is trying to assist it in giving it maybe through a dummy or something. Then they do the process very quickly, trying to feed the animal with milk, water, or it can be feed, or it can be medication that is being drenched. So commonly the drenching is done quickly or very fast. Then it goes into the wrong airways. So instead of it goes into the wrong airways, end up in the lungs, and the animal can die from pneumonia.
The symptoms that, are associated with pneumonia, like sort of similar to flu-like symptoms that we even have in humans. So could you maybe talk us through what these symptoms or early warning signs are that the herd may be developing pneumonia, or that, they may have already developed pneumonia?
There are early warnings to any disease that is starting. Pneumonia does not start suddenly. So animals show small changes first. So if a farmer does not catch the early signs, so treatment will be difficult. But if the farmer be able to identify the early signs of disease, then treatment will work much better. So what do I mean by that? So early signs is the most important stage. If in early disease, if you are able to identify early signs of that disease and treat it quickly, you are at a better chance of successfully treating that disease. There are first warning signs a farmer should always watch for every day on their livestock. So when the animals stop eating or it eats less, that's a sign of concern. And when the animals stays behind, animals normally walk in groups. So when you see animal lags behind, it stays behind, does not move with the group, it isolates itself from the group. It looks dull, the skin looks dull. Yeah, it looks quiet and depressed. It's a sign of concern for a farmer. When the animal is doing all those kinds of things, so a farmer should be concerned and do a closer examination on that animal. So at this stage, the animal may not be started coughing. So the animal may not be coughing yet and all these things happening, but something is happening in the animal. So the farmer should always be alert. So the things that I just mentioned, they are not all about pneumonia. So any disease, when it starts, the animal stop eating, staying behind, isolating itself, looking dull, quiet, and depressed, and not being interested in its surrounding. So it's a sign of concern. It shows that something is wrong with that animal. So number 2, when it comes to pneumonia, day 1 and day 2 later, after what I've said happened, so pneumonia is developing. So if there's no action taken, the lung infection becomes clear. Now you'll start hear the animal coughing, especially when moving. So the coughing will just start. It's a cough from the lungs. So there's 2 types of coughs. So there's a one from the lungs. You hear when it coughs, it comes from the lungs. There's another one which is sneezing. It's trying to sneeze something out of its nose. That one of sneezing, it can be something different. So it can be nasal worm, which we can talk about. Nasal worms, when you see a lot of mucus and they're just trying to sneeze it out. So we'll talk about that one later. But when it comes to pneumonia, it's coughing. Then you will have nasal discharge, similar to that nasal worm. So you will have nasal discharge from the nose. So mucus can differ from clear mucus to thick yellow mucus. Clear mucus, it shows that the infection is still fresh. The animal is in the early days of the infection. But when it's yellow and thick, then it has been there for some while. So fast and difficult breathing, the animal will be breathing difficulty and very fast. So breathing with effort. So it's effortless to breathe. But when the animal breathing takes the effort to breathe, then it's a sign of concern that a farmer can observe. So in this stage where treatment must start immediately on this stage, because it's still early days, you still stand a chance of successfully treating the animal. So number 3, advanced signs. These ones are very serious. By this time, saving the animal becomes very difficult. So it's an open mouth breathing. It's breathing hard and it opens its mouth. rapid and shallow breathing. Even the animal start losing weight, the animal may lie down, struggle to stand. So at this stage, the lungs have been damaged. Lung damage is often severe and recovery is very poor. Treatment can be successful, but you're standing here. The farmer has waited a very long time for this. So that's why early disease identification is very important for a farmer to always observe their animals every day, check if they are fine. If there's any irregular movement or abnormal movement that they are seeing, they should start acting quickly. So in simple terms, the first signs are not coughing. When it's coughing, that means it is already on an advance. You must observe those behavioral changes. Any animal that stops eating, separates itself from the head, legs behind, should be checked immediately. Early treatment saves the animal and it saves the farmer's money.
From what you're saying, it sounds like it's really important for a farmer to notice very early in the progression of pneumonia, so the incubation period. I'm curious, so maybe if you can just touch again on how early a farmer should notice the signs or take the signs seriously or the symptoms seriously. How will they know how long the animal has been sick for, how long the symptoms have been going on? So, of course, farmers, they observe their herd every day. Is it on day one that they need to take immediate action when they start seeing the animal, or should they give the animal maybe 2-3 days? What is your recommendation?
With animals, you have to act as soon as possible when you start to seeing behavioral changes. So some diseases, they can give you an opportunity to treat them even after you not acting fast. Some diseases, once they start showing signs, the animal die. So it differs from disease to disease. With pneumonia, the thing happens quickly. So the farmer should act as quick as possible when they start seeing the changes. So pneumonia can progress very, very rapidly, especially when caused by a bacteria. So in many cases, the disease can become severe within 24 to 48 hours. If it is not identified, if it's not identified and treated. So it is very important within the first 24 to 48 hours to act as a farmer. If you see those signs, get an antibiotic, then start the treatment immediately. So to support the early detection that I spoke about when I was talking about early disease identification. So AfriVet Training Services, we have developed a structured daily monitoring system, which is called the Daily Observation Card. So this tool is available electronically for livestock owners and trained observers. Observers, I mean the headers, the headmen, to assess their animals every day in a consistent and structured manner. So when a structured observation system is used daily, the header or the owner or whoever who stays with the animal is less likely to miss the first sign. So if they have that structured observation, so they are more unlikely to miss the first signs of disease. So knowing what a healthy animal looks like makes it easier to recognize when something is wrong with that animal. So that's what helps with the daily observation. So with bacterial pneumonia, bacterial infection, time is the most critical factor, as you asked, Patricia. So successful treatment is usually only possible when an appropriate antibiotic is used or is injected or it's administered at the very start of the disease. So when you see the signs of the disease and you are sure that this might be a pneumonia, so when you use an appropriate antibiotic and you administer it correctly with the right dose, so you are standing a very good chance of fighting that infection. So if the first signs are made, so the disease can progress rapidly. So if those first signs are missed, so the disease can progress rapidly. So another thing that I would want to add on this one is if treatment is delayed by even 1 day, that's how important the daily observation is. So if treatment is delayed even by 1 day, the chances of successful recovery become slim. So at this stage, severe production is lost because the animal is not interested in its surrounding, it's not eating, so it's losing its body. So there you are losing one severe production losses. So they occur due to those poor growth, reduced performance, and all those things, they increase treatment costs and possible animal death. So the animal can die after the efforts that you've put. So it makes it very important that when you see the first sign, you start with the treatment. So with pneumonia, within the first 24 to 48 hours, you should act as a farmer.
I do want to ask, though, you mentioned bacterial pneumonia, which I think would imply that there's another kind of pneumonia, so viral pneumonia. Is there a difference in the way the two different pneumonias progress in a herd?
We don't actually have viral pneumonia. That's tend to be corrected. So the virus, when the animal is infected by a virus, when it's infected, the immune system of the animal becomes weak, and the bacteria takes advantage of that weak immune system. So that's why we have bacterial pneumonia. It infects the lungs.
So would you say that when an animal is infected by pneumonia, there has already been, I think you said pneumonia would be a secondary infection. Is pneumonia always a secondary infection, not primary?
So pneumonia as an infection, pneumonia stands as an infection. So causes mostly are secondary. So maybe the animal is infected by a certain virus. Because of the process of that disease, the immune system is weakened. Then there's a bacteria that takes advantage of the situation, similar to aspiration pneumonia, whereby you dose quickly and the fluid gets into the wrong pipes, it gets into the lungs. When the animals are traveling, they're stressful, then they trigger pneumonia. So there's a lot of things that can cause pneumonia.
Okay, so it sounds like when you're treating pneumonia, you're actually not only treating pneumonia, but as you said, the causes of it as well, that may have been even a virus. Earlier, you mentioned that if farmers delay in treating it, it reduces the chances of a recovery. So what immediate steps should be taken once pneumonia is suspected?
When the first signs of pneumonia are noticed, such as coughing, nasal discharge, standing alone, and difficulty in breathing, so the animal must be examined immediately. So if a farmer must do a closer examination. Step 1, they must check for fever. So that's the most important steps. That's why even here in AfriVet, we always advocate for farmers to have a thermometer. So a thermometer is a very important tool that the farmer must have. So the first step to do is mostly important is examination. You do a closer examination to that animal and you take the temperature. So normal temperature when you take it in the morning, early in the morning before the animals are working and doing their daily activities. And also when you want to do it later, then you do it maybe an hour or two after the animal has came back from grazing, after they've relaxed and their body has cooled down, so that you don't get false temperature of the sun or floating and everything. The normal temperature is 38.5. So when the temperature is above 40, that's an indicator for fever. And fever is a clear sign of serious systemic infection. So most commonly affecting the lungs in this situation. So this is an emergency. Whenever fever is high, it is an emergency and it requires immediate treatment. So it is important. In some cases, coughing and nasal discharge may be caused by irritation of the nose or irritation or mild infection of the nose and throat. So if the animal's temperature is normal, treatment is not needed at this stage, but the animal must be monitored daily. So as I said, it can be the nose is irritated or the throat is irritated. The animal is just coughing, but the temperature is normal. So the animal need to be monitored daily and to check if the fever may not develop, if pneumonia is not starting. Step number 2, the farmer must act fast. So time is critical when it comes to pneumonia. So the window for effective pneumonia treatment, as I said, is the first 24 to 48 hours. So if the animal has breathing signs, fever is high, immediately inject an antibiotic. Immediately inject an antibiotic that treats pneumonia. So in case any antibiotic oxytetracycline that is specified that it treats pneumonia can wait. But here in AfriVet, we have Ultratet LA200. So Ultratet LA200, you can get it at any co-op. It's a broad spectrum and a long-acting injectable antibiotic. So it treats for conditions caused by or associated with oxytetracycline. I'm just reading the product label. So it's treatment for tick-borne heart sickness, hard water, pneumonia is there, foot rot, joint ill, navel ill, and pink eye. So if you have a problem of pneumonia, if you've identified all those signs, you can use our Ultratet LA200. You inject it properly. Then you can also use a product called EcoSolve. So EcoSolve also, you can get it in the co-op. The description on it, it says treatment for foot rot, navel ill, joint ill, and pneumonia in stock. So these are the antibiotics of choice that you need to use for proper treatment. So you should have all this in your farm, readily available in your farm. As I've said, time is very critical. If you see all these signs and you're running to the co-op, by the time you come back, the animal might have died. You would be lucky if you find it alive. So that's why you need to have your drug box with antibiotics, a thermometer, a weight band. Weight band is very important because you inject the animal with a proper dose according to the weight. Ultratet, it says 1 ml per 10 kg. If the animal is 50 kg, you need to inject 5 ml. With EcoSolve, it says 1 ml per 10 kg, but you have to do it for 3 days. So meaning first day, 5 kg, 5 ml for 3 days. And with EcoSolve, it gives you that description to say, first treatment, you double the dose. So if the animal weighs 50 kg, it's a sheep, then you need to inject 10 ml. 50 kg means 1 ml per 10 kg. That means you will inject 5 kg. 5 ml, again. And if they're saying you should double the dose, meaning if you were supposed to inject 5 ml, you will have to inject 10 ml for the first day, 5 ml the second day, 5 ml the third day. So all these things, they help the animal recover effectively. They make the antibiotic work effectively. Most of the time, our antibiotics are not working effectively because we are not doing the right things. So thirdly, you need to support the animal. So you need to provide supportive treatment. So supportive care helps the animal recover faster and cope with stress. So we have a product called Afilvet Electrogut. Electrogut assists the animals with reducing stress. If the animal is refusing to eat, it assists with that. Dehydration, if that animal hasn't been drinking water or it has been having diarrhea, it helps with the dehydration. It supports the rumen function and prevent rumen stasis. So you use an antibiotic plus use Ultratet plus Electrogut. So it gives you a very better chance of successfully treating that animal. So what key messages that I can give on this? Check early, take the temperature, and treat fast. So fever, when you see fever, there's a systemic infection, so you have to act quickly.
I think you mentioned with fever, obviously that is determined by temperature, and the temperatures is what will really tell you how serious the infection has gotten, hey?
Yes.
All right. And you also shared some of the products, so yeah, thank you. I think the farmers who are listening will definitely, make sure to have that in their medicine box. As you've said, it's important to already have these drugs available on the farm. With that, as you mentioned, farmers will then inject the treatments. But when does a farmer know to call a vet or an animal health technician rather than trying to deal with the situation themselves? Because, of course, they do have the ability to administer this medication. But when do they know, okay, this is beyond my capabilities and they need to call a vet or animal health technician?
While a farmer can often manage early disease or early pneumonia cases, so there are times when a professional help for sure is essential. So you should call your vet or animal technician if you have treated the animal correctly, but there's no improvement. More than one animal is sick in your head. Symptoms persist or worsen despite proper treatment. And so you will involve your vet. If you have access to a vet in your area, for sure there are state vets, there are animal technicians that work for the state. It's always important to have their contact and always keep them in the loop of what is happening. Even before you do the treatment, if you have that access to them, you can always ask them for confirmation of that diagnosis. So you can always call a vet to confirm if for sure you are dealing with pneumonia, or ask for advice on correct treatment or dosing to avoid underdosing or overdosing. You can also always call for guidance on which supportive care you need, like I've highlighted that with an Electrogut. So you can always call to ask that what can you add on the treatment. Maybe if you have an Ultratet, then we can always advise you to use also. electroguard that quickens the recovery prosper time. And also long-term strategies, a vet or animal technician, they can also assist you with long-term strategies, how to prevent pneumonia, as we've highlighted above.
And I think you've mentioned earlier with the medications that you were speaking about, that's their broad spectrum. So for a farmer, maybe they're assuming that it's pneumonia and maybe it's not. When it comes to diagnosing, if they're using the broad spectrum, is that an issue? I suppose misusing the medication, is that something that can occur?
A good thing with AfriVet training services, we do our trainings to the farmers just to train them on, because we have different types of disease controls in South Africa. So there are notifiable disease, there are controlled disease. So state vet mostly get involved when they are the controlled diseases. So like FMD, like when you see the lesions of FMD on the tongue, on the mouth, that's when it's very important for a farmer to call the state vet so that the state vet can come and confirm the case they are saying. But with diseases like pneumonia, with the clinical signs that we have highlighted, so a farmer can clearly see if the animal is coughing, having mucus, breathing difficulty, chances are it is pneumonia, and they can treat with that broad spectrum antibiotic, which is Ultratet LA. That will help them in that case. That's why I mentioned that after treating and the disease still persists, then that's when they can contact their vets or animal technician in their area.
It makes so much sense. Thank you. You have already touched on it. I don't know if you want to go into it, but how important is early treatment in improving recovery rates and reducing losses?
So yeah, this is a very important question. We should have moved it up so that farmers, when they listen, it's one of the things that they catch there. Because early treatment is the simple, most important factor in saving animals and reducing losses from pneumonia. The concept that we do at AfriVet when we say early disease identification, primary animal health care, that we teach to our farmers is to value their animals and know that their animals is cash, is converted to cash. So the animals is money. So they are running a business. So how does this topic get there? Early treatment, it saves money, it saves animals, and it saves time. They are all valuable to a farmer. Money is valuable to a farmer. If you are running a business, you don't just want to spend any. So you should account for every cent. So healthy animals, that means you have a healthy cash flow. Time is money. So I have some points. Point number 1. Early treatment. What does early treatment does? It improves the recovery rate. So with pneumonia, it progresses quickly, as we said above, in 24 hours. So treating the animal at the first signs gives you the best chance of full recovery. So once the pneumonia becomes advanced, then you need to buy an antibiotic. An antibiotic, you need to buy a lot of supportive products. So treating early, it gives you the best chance of treating. Number 2, reduces death and losses. So if you treat early, animals treated late are more likely to die or suffer long-term effects such as poor growth, reduced milk production, and chronic coughing. So if a farmer has treated early, so they won't need to spend more money on feed to get the animal back to the normal weight. Because if you treat early, the animal won't lose much weight. But if you treat late, the animal will lose weight, will cough. And when it coughs, it might cough. When it's sick, it might cause other infections in the body. So you might be dealing with more than what you would have treated once. So early treatment protects the herd, preventing the disease from spreading and keeping more animal healthy. So if you don't treat early, the disease will spread to the other animals that are vulnerable. The last one, it saves time and money. So treating pneumonia early is cheaper and easier than dealing with severe cases or multiple sick animals. So if you can treat one animal, you are saving the rest of the herd from getting infected from that animal. So it's saving you time and money. So delayed treatment can lead to higher veterinary bill, losses of production, and more stress on the herd. So my key message on that one is that if you catch it early, you must treat it fast. So the first 24 hours after noticing symptoms are critical. Quick actions save animal time and they save money.
And speaking again about treatments and the role antibiotics play in treating pneumonia, I know antibiotic resistance is a thing, which is maybe a common mistake farmers make during treatment. So maybe if you could talk us through some of the common mistakes farmers make when they're treating animals with the medications that you've mentioned.
So the role of antibiotic in this case, is for treating pneumonia. So antibiotics are a key tool in fighting pneumonia. They kill or stop the growth of the bacteria that is causing the infection. So by doing that, they will be reducing the bacterial load. They give the animal's own immunity a chance to fight the disease. And when the antibiotics are used correctly, so they increase the chances of animal recovery. So what are the common mistakes that farmers make when using an antibiotic? So many treatment failures are not because the antibiotics don't work, but it's because they are not used correctly. So these are the common mistakes. Wrong dose. So giving too little or too much can reduce the effectiveness of the antibiotic, and it can cause what you mentioned, the resistance. So it can cause resistance. The animal might not recover because of the wrong dose. In this case, if I can just explain briefly with the Ultratet, so it will tell you 1 ml per 10 kg, inject intramuscular or under the skin. So those are the things that a farmer should look for. So another thing is incorrect injection site. So the medication must go where it works best. So usually intramuscular or subcutaneous, as I said, depending on the product that you are using. With the medication, with this antibiotic, sometimes if you're using a fast-acting antibiotic, it will tell you inject for 3 consecutive days, then stopping treatment too early. Animals must complete the full course even when the animal is feeling better. So when they say 3 days, as I said, with the EcoSolve, you must do the 3 days, inject for those 3 days. The fourth one, poor storage. They say put it in a cool area, must not be exposed to the sun. So do that so that medication can become effective. So all in all, not reading your product insert. That product insert is very important. The product label inside the medication. So it will tell you all these things, how many mils to inject, or if it's a dosable thing, how many mils to inject and how to do it. So paper is very important. Or you can call us here at Freevet if you want an Ultratet or EcoSolve, then you want to use it, we will give you that information freely. So key advice is that always read the product insert carefully before use, follow the correct dose and route of administration, complete the full course of antibiotic, store it properly. When you doubt, then contact us or contact your veterinarian or your animal health technician.
Kenneth, you mentioned earlier that stress can increase the risk of pneumonia developing in a herd. So what practical management changes can farmers implement to reduce the risk of pneumonia occurring?
Pneumonia is often caused by germs, as I said, plus stress. So while we can always control the germs, good management can prevent most cases. So here's a practical step a farmer can take. Number 1, provide proper housing or shelter. So keep the animal in a dry, not dusty shelter. Protect them from wind and cold. Ensure good ventilation to remove the moisture, the dust inside the ammonia from the manure. Avoid overcrowding. Give each animal space to breathe and move comfortably. Number 2, maintain cleanness. Where the animal stays should always be clean. Say regular, remove the manure to prevent dust and ammonia buildup. Keep feet dry. So sometimes the feed can be too dusty, so that dust gets into the nose of the animal. Avoid moldy and dusty feed. Number 3, handle animals with low stress. You know, our farmers who listen to our podcast don't stress animals, throw stones in animals, shout in animals, create an unfavorable environment for animals. No, they should handle the animals with low stress, minimizing rough handling. So they must be gentle when it comes to their animals. Unnecessary movement, mixing of unfamiliar animals. So all those things, they cause stress to animals. And also, the stress weakens the immune system, as we said, and can make more animals susceptible to pneumonia. So number 4, follow proper dosing and health practices. So when you are deworming, maybe with a radworm dewormer, maybe that animal is sneezing and there's a lot of mucus, then the farmer maybe got an advice that it can be a nasal worm. So farmer, when they're dosing a radworm, they should make it dose properly and slow, because if they do it quick, it might end up in the wrong pipes, then it goes in the lungs and cause that aspiration pneumonia. So always dose properly and observe the animal daily. As we said, early detection is key. Watch the animals every day so that you can be able to identify those who are lagging behind, those that are coughing, and those are refusing to eat. So you can only do that if you spend more time with your animals and you see all these isolated cases. So in simple way, good housing, clean feed, low stress, and careful health management are the best way to prevent pneumonia. And prevention, as we always say, prevention is cheaper and more effective than treating an animal. So if you can prevent, because it will be more cheaper than treating.
I love that you're even making the sneezing sounds of the animals for our listeners. Yeah. Yeah, I don't know, Kenneth, looking at the weather and seasons, does that influence risk of a herd developing pneumonia?
Yeah, it does. So certain seasons and weather conditions significantly increase the risk of pneumonia outbreaks in livestock. So during cold months of the year, farmers, they face major challenges. So keeping animal warm, comfortable, and well-fed and healthy require careful planning and management. You can imagine when it's winter, it's cold and there's no proper feed. So the animal are stressed. So it's very challenging for the farmer in those season, and pneumonia in particular occur more frequently during this period. So an increase in pneumonia cases, we notice them during the transition of periods. So when there's a transition of seasons, so when we are moving from autumn to winter, in that space, that when we see cases of pneumonia, winter to spring, so sudden change of temperature can trigger pneumonia. So although here in South Africa, pneumonia can occur throughout the year, so the risk becomes much higher when animals are placed under significant stress, increasing their susceptibility to respiratory diseases. When the first case of pneumonia is detected on a farm, it should be treated as an early warning sign. So this indicates that the environmental conditions has become favorable for the disease to develop. So a farmer should start monitoring from there. When you see one case, so know that it's likely to happen in your farm. So several factors suppress the animal's ability to resist the disease. Stress play a major role, as we said, as it reduces the normal, as we said, the stress weakens the immune system of the animal. Nutritional deficiencies, particularly in adequate protein, vitamins, and minerals, further weakens the immune system of the animal. Cold, dry, dusty conditions also contribute significantly to the development of pneumonia. So as conditions become drier and colder, dust levels increase. So dust irritates the respiratory tract and damage the mucous membranes, so which act as the first line of defense by preventing the disease-causing organisms from entering the lungs. So maintaining a good mucous membrane health is therefore critical for keeping the respiratory system healthy and disease-free. The farmers, when they realize these first signs of diseases, they should act quickly. Acting quickly saves them money. As we said, it saves them time and it saves them their animals. So early disease identification, it's very important for you. So for more information about our product, you can visit our website, which is www.afrivet.co.za. In that website, you can find our products, and you can also find our AfriVet agents. If maybe you stay in Polokwane, you stay in Pretoria, Kuruman, we have our agents stationed there. So if you have any problem, they would understand your problems, your farm challenges better because they are in your area. And we also have free courses that we offer through AfriVet Academy. Courses like primary animal health care, if you want to know more about antibiotics, on how to use them, if you want to have an effective treatment for pneumonia, we have a course for Ultratet 200, how to use it effectively. So you can visit our website, which is AfriVet Academy. When you completed that course, you can get a certificate. We are very nice people at AfriVet. We give you a certificate for completing a very free course. So or you can call us for early inquiry. You can call us on 012-817-9060 for any assistance. And the farmer can always call us if they need any further explanation of what was said on the podcast.
Thank you so much to Kenneth Malatji, who is an animal health technician at AfriVet. Of course, you can read more about this on www.foodformzansi.co.za. And that brings us to the end of this episode. Remember to subscribe to our podcast on your favorite platform. From myself, Patricia Tembo, our technical producer, Megan van der Vent, and the rest of #team Food for Mzansi, thank you for listening and keep growing with us.